We all know that healthy children learn better. Nurses from the Cumberland County Public Health Department School Nurse Program are working hard to make sure our little learners are healthy. Pamela James, registered nurse and supervisor of the School Nurse Program, tells us how these very special nurses put to use their compassion and patience to make sure our students learn good health habits at an early age.
The Cumberland County Department of Public Health School Nurse Program is a program that helps to establish and maintain the health of children in the school system. Our nurses are out there to help children stay in school. Healthy children learn better. Healthy children are going to be in school, and they're going to be the ones that have the most success in their academics. And so we have a lot of referrals from teachers that say, Johnny is not seeing the board very well, or I think he squints when he's trying to read. So they'll refer them to our school nurse team, who will screen them. We have either the wall charts we screen with or our titmus machines that we screen with. And if they find the child doesn't do well, then they will refer them to the appropriate professional. We do a lot of other screening services as well. Certainly communicable disease is one, and to refer children who need to a physician. We see a lot of children who may or may not have pink eye or skin rashes and may need to refer them as well. Surprisingly enough, what I found interesting as I was doing some research is that about 30% of our time is spent on mental health issues with the children, whether that's homelessness, or whether that is a child who doesn't have enough food to eat in the house, or whether that's a child who has depression, because we've seen children with depression in the school, anxiety, test-taking anxiety. So our team does spend time with that as well. There are 85 schools in our system here in Cumberland County. There are over 53,000 children, and I have 3 school health teams. Now, a team it consists of a team leader and 7 nurses. The team leaders do give direct services, but the 7 nurses on each team, to a total 21, are the ones who provide the bulk of the services in the school. So I have 21 nurses who provide services to 85 schools and 53,000 plus children. This is a great way to reach children, to start teaching them healthy habits from kindergarten on. And then we have the older kids who benefit from our asthma classes that the nurses hold in all the schools. They pick one school that seems to have maybe children who have more children with asthma than some of their others. And they have the open airways classes from the American Lung Association. They've all had the training. In fact, they can demonstrate use of their inhalers. They can tell you better behaviors and ways to control their asthma. We're really getting into nutrition now with the obesity epidemic that we have in our schools, as well as diabetes management. We have a lot of kids with chronic conditions in our schools now that our school nurses are responsible for helping manage. The big point of interest to me is that if these children don't have a healthcare professional, then the school nurse many times is the only healthcare professional these children ever see. And so yes, they're very much on the front lines, and they're very much responsible sometimes for following up after they refer to make sure the children have the services they were sent for, and making sure their conditions are resolved. I'd like to let everyone know that even though we have 21 nurses, we have 85 schools. And so that if you do the math there, you find out that each nurse has 4 to 6 schools apiece. And a lot of people from other states especially think that here in our county we have 1 nurse per school who's there every day, and we don't. Again, they have 4 to 6 schools apiece, so they have to go to their school 1 day a week. They're on call the rest of the week, but it is imperative when they're there that they maximize their time, and they love maximizing their time with the kids. They spend time in the lunchroom. They go look and see what they eat. They will tease them. They know a lot of them by name. I know one nurse who makes it a point to try to speak to every child almost every day. I'd like to remind everybody, even though it's not too late, and this is a plug for school health as well, because if your child gets flu, they're not going to be going to school. So if your child's not had a flu shot this year, I'd really like to encourage everyone from 6 months on up to get their flu shot. It isn't too late. The flu season actually has not peaked yet. Some of the prime flu season in North Carolina is this time of year, February, March. We've got flu shots still. Please get your flu shot. That's what we'd like to encourage everyone to do. Now, we are located at 1235 Ramsey Street. We are across the parking lot from the Department of Social Services. Thank you so much for allowing me to talk about the school nurse program, because obviously I really love what I do, and I'd really love for anyone who's interested in the school nurse program, especially nurses who think they might want to apply, to always check our website for open positions, and hopefully we will be growing and adding more positions to our 21 team members. And I'd just like to end with a couple of things that we have 4 to 6 schools. We'd love to have a nurse in every school, because every child deserves a school nurse. Every teacher deserves a school nurse. The teachers need to teach, not be nurses. And every parent deserves a school nurse, so we know that their kids are safe at school with their health issues if they have those.